Oh, good. And we are live. Hello, everyone. I am thrilled to be here with you today. I am going to share this real quick on my Facebook page so that I see people already joining in. I'm going to do this real quick so that other people can find us. Here we go. Got it. And I'm going to share this in the More Than Lupus. Where are we here? More. Perfect. Hi, everyone. Welcome. Well, I've heard it said a cheerful heart is good medicine. So let's hope that's the case today because I am very, very glad to be with all of you today and so thrilled to have such a special guest back with us to get to the heart of the matter. And some of you may know that's one of my favorite songs. I believe it's the Eagles, trying to get down to the heart of the matter. That's what we're going to do today. So welcome and thank you for joining us for this special educational symposium entitled Getting to the Heart of the Matter, How Lupus Affects the Heart and Cardiovascular System. This is a special live event in honor of Heart Health Awareness Month. And this is in collaboration with the author of the Lupus Encyclopedia and the creator of lupusencyclopedia.com, Dr. Don Thomas. I'm going to bring him on in just a moment. And my name is Kelly, and I'm the creator and executive director of the Portland-based nonprofit More Than Lupus. And if you're unfamiliar with More Than Lupus, we are a multi-ethnic, multi-generational, and international lupus community designed by lupus patients to connect and to grow and to inspire each other throughout the peaks and valleys of our lupus journeys. And I say our because I have been living with systemic lupus and multiple lupus overlap conditions since the age of 11. And we believe that every person living with lupus, no matter their background, should be treated with equity and dignity and taken seriously. And it is our mission that patients feel seen and they feel heard and they feel valued. So today's event will spotlight the many ways that lupus intersects with cardiovascular health and how, as patients, you can take the reins and pursue cardiovascular wellness. So we hope the information provided today not only helps you, but also your close family and friends as well who may be watching. Also, there will be a question and response time at the end of Dr. Thomas's presentation. So please write down any questions and post them here in the chat box, and we will do our best to address them all before the end of this session. Now, we are coming to you live from Facebook and YouTube. And just a reminder that any spam or inappropriate material or negative comments will be prohibited. And I will be monitoring that from behind the scenes on my end. So please keep all comments positive, and any inappropriate material will be deleted. As I said, I see it, and then you just have to refresh your page. So, by the way, before we move forward, let me go ahead and give you a brief disclaimer. Please understand that the opinions shared today are purely for informational purposes and do not replace the medical advice and or opinions of your doctors. If you are experiencing lupus or lupus nephritis or lupus overlap symptoms, it is important to follow up with your doctor and to seek the treatment that is best for you. If you suspect you have cardiovascular involvement, it is pivotal that you reach out to your physician or health advocate for more advice on that. Our panelist today is a qualified professional. However, he is not liable for his comments since he is not acting as your personal physician or health advocate. So it's time that we delve deeper into this conversation, and I'm thrilled to have Dr. Don Thomas, the author of the Lupus Encyclopedia, now in its second edition, here to lead this conversation. Hello, Dr. Thomas.
Hello, Kelly. And Eagles is one of my favorite groups. One of their songs is Heartache Tonight, but my favorite is Seven Bridges Road. I love that song.
Oh, my goodness. Hotel California is also one of my absolute favorites. So had the privilege of seeing them live a couple of times. So once in a lifetime, really just wonderful, wonderful. So Dr. Thomas, I know a lot of people who are joining today obviously know who you are, but just in case we have some new community members watching this live on Facebook or YouTube or streaming this later, do you mind telling everyone a little bit about yourself before you dive into the topic today?
Sure. So my name's Don Thomas. I'm a rheumatologist. I specialize in autoimmune diseases such as lupus and Sjogren's disease. My very first rheumatologic patient I saw as an intern was a lupus nephritis patient back in the early 1990s. And I just still remember the only thing we could do for her was give her high dose steroids. And I wanted to be able to help people like her. And so that's what made my love for rheumatology and helping lupus patients, because there's so many things that lupus patients can do to improve their health above and beyond just taking the medications. And so I love educating patients on what to do. I practice in Greenbelt, Maryland. I'm a clinical professor of medicine at the Uniformed Services University in Bethesda, Maryland, where I love teaching residents and fellows and medical students as well about lupus and related diseases. So first, let's go ahead and get started. But I'd like to start off with just telling you about one of my patients. One of my patients, I'll call her Mary. That's not her real name. But she had, she has lupus. I still see her all the time regularly, and she had polyarthritis, fatigue, rashes from her lupus, and she went into remission on hydroxychloroquine, which 30% of our patients do, and she would just always look perfectly normal when she would come into my office, but one time, her C3 and C4 complement levels went lower than normal. That's one thing that can happen with increased disease activity. But when I saw her, she was asymptomatic, no problems whatsoever. She felt great. Well, the next time I saw her 3 months later, we see our patients every 3 months because we do like to get a urine sample because we want to, 40% of our patients will develop lupus nephritis and we want to catch it at the earliest stages when it's curable. That's the reason for every 3-month follow-ups. But she came in and she told me how she had been in the hospital a couple months earlier and that she had a problem with her heart and she went into heart failure. She was now doing okay on heart failure medicine. She felt great. I got a copy of all of her records. And lo and behold, she was actually in the hospital with new onset heart failure due to a problem called myocarditis, which is inflammation of the heart muscle. And now she had cardiomyopathy, permanent damage of the heart. Well, I was livid. The reason I was livid is that nobody told me what was going on. I have another patient who had a very similar story. He had a lupus attack his heart. His cardiologist never told me about it. I could have treated both of these patients when they had the active inflammation and prevented the lupus from causing permanent heart damage. And today, both of them, fortunately, are doing well, but they're on chronic heart failure medications. The lesson out of this is please, every time you see a specialist, no matter what specialist, even if you don't think it matters, verbally ask that specialist, please send my rheumatologist so-and-so a copy of your note and a copy of the lab tests. The reason, don't just tell the staff, it will never go to the staff. The doctor has to be the one to direct that the note be faxed to them. Even better, always get copies of every single doctor's note, every lab test, every kind of test period, and keep one at home for your permanent records, but also give a copy to your rheumatologist. Protect yourself. Be proactive in your healthcare. So this brings us to today's topic, heart involvement in lupus. Pericarditis is the most common heart involvement in lupus. When autopsy studies were done way back in the day on systemic lupus patients, 60% of them had evidence of pericarditis. And what is pericarditis? Well, the heart is a beating muscle, and around the heart is a very thick piece of tissue called the pericardium, and it basically holds the heart in place. But there's lubrication between the pericardium and the heart, and it acts like oil, and lubrication, so that when the heart beats like this, it glides smoothly inside of that pericardium or heart or sturdy tissue. But lupus loves to attach that area between the lubricating side around the heart. And when it does that, we call it pericarditis. Even though 60% of patients have pericarditis on their autopsies, only 25%, or 1 out of every 4, actually have the symptoms of pericarditis. And the symptoms are generally chest pain that hurts when you try to take in a deep breath, and typically it gets worse when you try to lie down. That's classic for pericarditis. If you ever get those symptoms, please make sure to let your doctor know or your rheumatologist know as soon as possible so you can get the right treatment. Now, fortunately, pericarditis generally is not that dangerous. It doesn't generally cause damage to the heart muscle itself, but it is painful, and that's the reason we have to treat it. Another problem that can happen with the heart from lupus is myocarditis. That's what both of my patients had, who went into heart failure. Generally, this can cause chest pain and shortness of breath, and we can diagnose it on an echocardiogram, which is an ultrasound of the heart, where we see the heart muscle not working normally. And on the blood test, we'll see high troponin levels, which is an enzyme released by the heart. We have to treat it with high-dose steroids and immunosuppressants because it can stop that inflammation. We can actually prevent permanent heart damage. There's 4 different chambers inside of the heart, and all of them have a valve that lets blood go through, and then it closes, and then it lets blood flow through, so that the blood goes through to the right areas of the heart and to the lungs and to the rest of the body. But sometimes those can be affected by lupus. It's a condition called Liebman-Sachs endocarditis, and it's a problem where antiphospholipid antibodies will cause little particles of clot to fix on the valve, so they don't work normally. They'll either leak or they'll be tighter than normal, and this is something we can also pick up on the echocardiogram. We need to treat it with blood thinners when we see this particular condition. Another potential problem with the heart is the electrical system. There's actually an electrical system that tells each chamber when it should beat. The atria should beat first, and then the large ventricles, then the atria, then the ventricles. But sometimes things can go wrong, and if there's inflammation or damage from lupus that occurs in the electrical conduction system, people can get things such as atrial fibrillation, or a slow heart rate, or a fast heart rate. A slow heart rate, by the way, is called bradycardia. Brady means slow, cardia means of the heart. Fast heart rate is called tachycardia. Tachy meaning fast, cardia, of course, meaning the heart. Interestingly, a lot of lupus patients will get a fast heart rate when their lupus is more active. So we call that sinus tachycardia, and that can sometimes be a sign of active lupus. If you ever get heart palpitations, or if you ever notice a fast heart rate on your iFit or your Apple Watch, or which many of us are using those these days. A fast heart rate, by the way, is anything above 100. Then please let your doctor know. We would usually have you wear a heart monitor for anywhere from 24 to 72 hours to see if we can see exactly what's going on with the electrical conduction system of the heart, so we can reach a proper diagnosis and know how to treat it. Another thing that can happen with the heart is that we have no control over the heart muscle. We can't tell our heart to beat faster or slower, and that's because it's controlled by a part of the nervous system called the autonomic nervous system. Think of the autonomic part as automatic. It just automatically does things. We can't tell it how to do things. So it tells our heart rate. For example, let's say we're going to go out jogging or running. Our muscles are working hard. They need more oxygen and nutrients, and so we need the heart to push to squeeze more blood to those organs, and so the autonomic nervous system does that. Lupus can affect the autonomic nerves is something called dysautonomia or autonomic nervous dysfunction. And just a couple of examples is dizziness or lightheadedness. There's a condition called POTS, postural orthostatic tachycardia syndrome, where people with that condition, they'll stand up and the heart should be squeezing harder when that happens. But in these particular people, it doesn't squeeze as hard as it should, and it has to beat faster because of the autonomic nervous system. That's the tachycardia part. And it can cause things like lightheadedness, dizziness, but also many other symptoms as well. Something that can mimic that is something called orthostatic hypotension. That's another dysautonomia that we can see in our lupus patients, and both of these are treatable. If you do get dizzy or lightheaded with standing, you don't have another reason for it, like a blood pressure medicine or a diuretic or something else that might be causing that, then see if you can find a dysautonomia specialist in your area. They would do tests such as a tilt table test to figure out exactly what's going on so we can give the proper treatment. So those are some of the major ways that lupus can affect the heart, but there's something that's more important. Most of you know the singer Toni Braxton. Toni Braxton is a wonderful singer, beautiful voice, but she has severe systemic lupus. The way she found out about it is that she was admitted to the hospital and because of a heart attack. The lupus had caused clogging of one of her arteries. This is something called coronary artery disease. And unfortunately, systemic lupus patients are at high risk of heart attacks and strokes due to clogging up of the blood vessels. If you do a Google search for Toni Braxton heart monitor and look up images, you'll actually see one image of her actually having a heart monitor on while she's at one of her performances. But she's doing very well with her lupus, thank goodness, and she continues to perform. But the reason I'm bringing up heart attacks and strokes and clogging of the arteries is that cardiovascular events, heart attacks, strokes, and blood clots, all as a group, they're the #1 cause of death in lupus patients. It's important to know what the most common causes of death are, because if you know what the bad things are that can happen to you, then you know the right things to do to prevent them from happening, because they are preventable. The second most common cause of death is infections, and that's why we stress that all of our patients get all of their vaccines, because most of those infections that I see patients die of are preventable with vaccinations. But let's go back to heart attacks. So since heart attacks are one of the most common causes of death, how can you prevent it from happening? Well, of course, eating a good, healthy diet, eating the Mediterranean diet, for example, an anti-inflammatory diet. If you're not sure how to eat an anti-inflammatory diet, just go to my website, lupusencyclopedia.com, and type in anti-inflammatory diet, and you'll find my recommendations there. Also, regular exercise. Just to give you an example, our exercisers with lupus, they do so much better in the long run. I have lupus patients now who are in their 70s, 80s, and even 90s. Most of them are exercisers. Most of them they eat a healthy diet. Most of them follow my lupus secrets, which you can also find on my website. But it's really important to exercise regularly and to eat healthy. And by the way, everyone can exercise. Everyone, even if you're telling me you have severe pain and fatigue, you can exercise. And if you do exercise, I guarantee that if you do it regularly, you 100% will feel better. But there's a trick. If you feel like you're too sick to exercise, ask your rheumatologist to refer you to a physical therapist. The physical therapist can assess your physical condition and your health condition and design a safe and effective exercise regimen that you feel comfortable with and that you're able to do. You start off low, you go up slow, and you absolutely can do it, and it will absolutely help you out. So one of the most important things about preventing heart attacks and strokes, by the way, is a trick called know your numbers. If you get one thing out of today's talk, it's this: know your numbers. I want you to be proactive in your health care. You should always want to know what your blood pressure reading is, your total cholesterol reading, your LDL bad cholesterol reading, and your hemoglobin A1C, and your BMI, or what weight you should actually be at. Another bad type of cholesterol that they're recommending that we now check is called lipoprotein A. So also ask your rheumatologist or primary care doctor to check your lipo A level as well, because that's a risk factor for heart attacks in our lupus patients if it's high. So just like some examples of your numbers for the blood pressure. By the way, I hope everyone has a home blood pressure machine and that you take your own home blood pressure readings. The American College of Cardiology now recommends that we go by home blood pressure readings, more so than what we get in the office. I recommend that you check your blood pressure several days in a row before all doctor visits, write down the numbers, and then hand give them to your doctor so that they can record it in your record for that visit. And then we'll have a better and more accurate way to know what to do with your blood pressures. Your goal for a home blood pressure for most people should be less than 125 on the top number, less than 80 on the bottom number. Now, your target may be different. For example, older people may get too lightheaded if they get that low, so their doctor may have a different number, like less than 130 and less than 85 on the bottom number. So ask your doctor, what is your target? Then what do you do with that number? If you see that your blood pressures are higher than those numbers, because you want to know those numbers, then you want to ask your doctor, what can I do to get those numbers under control? Should we go up on my blood pressure medicine by the dosage? Should we add another blood pressure medicine to it? If it takes 4 blood pressure medicines to control your blood pressure, you want to do that, because studies show that doing that decreases your risk of those heart attacks and strokes. Some other numbers: total cholesterol, usually we want it less than 200. Make sure you always fast for your blood work so that you get an accurate reading for the total cholesterol. The LDL, which is the bad cholesterol, we want that less than 100. But some people with a lot of risk factors for heart attacks and strokes, we want it less than 75. So make sure to ask your doctor what your target is. Lipoprotein A, the normal value is less than 75. We're really not sure what the best target level is for that right now, but that's still something that's being tried to figure out. But we do know that if it's high, it's a risk factor. Hemoglobin A1C, which measures the average of your sugars over the previous 3 months, we want it to be less than 5.7% normally. If you have diabetes, usually we want it less than 7%. And by the way, hydroxychloroquine helps to reduce glucose levels and then reduce that hemoglobin A1C. So please take your hydroxychloroquine religiously, because it will help the hemoglobin A1C, and also it lowers to cholesterol levels as well. And then of course your BMI. Exercise, eat healthy, work on losing weight to get your BMI less than 25. Something that's more accurate, by the way, if your rheumatologist has a bone density machine in their office like we do, a lot of us can do something called body composition analysis. The machine can actually measure how much fat and how much muscle you have. It's much more accurate for figuring out what your healthy weight is. And just an example, a bodybuilder with big muscles, could have a BMI of 30, which is too high, quote unquote too high. It should be less than 25, but we know he's healthy because he has very little fat and just a lot of muscle. So knowing your percentage of body fat and your percentage of lean muscle mass is much more accurate. For example, there's a problem in our lupus patients. There's something called sarcopenic obesity that's very common. What that means, sarcopenic, sarco means muscle, penic means too little of. It means that they'll look skinny, they'll have a normal BMI, but they'll have too much muscle, or I'm sorry, they'll have too much fat and not enough muscle. And that's actually an unhealthy situation, and it's actually obesity, because the definition of obesity is having too much fat for someone's health, and it causes health problems. Now, why does that happen to our lupus patients? Well, for many reasons. Number one, the fatigue and pain can cause you to move around less, exercise less. The muscles get smaller, more fat builds up in the body. But also the steroids. The steroids are one of the worst things, because steroids allow us to break down muscle and build up fat. And any of you who's been on steroids a lot know exactly what I'm talking about. But if you do a body composition analysis, you can figure out exactly if you have obesity or not. And then you can use that to work on your weight and get rid of fat mass and build up muscle mass by doing muscle strengthening regularly to help that out. So Kelly, that's the main things I wanted to talk about. And if you have any questions, or anyone watching this has any questions, I'm more than happy to answer them.
And I'm muted. Yes, there are many questions here, and I just want to say A+ for me, because I have my blood pressure cuff right
Good job.
here.
Thank you.
Because I went to my primary care 2 days ago, and I do that. I take my readings at home before I go in, because sometimes you're rushing around and you're trying to get to an appointment, or you get nervous because you have a bunch of things to talk about, and my blood pressure gets a little bit higher than usual. So I like to do this at home before I go in, and just make sure. So,
and you know, there's also another phenomenon, Kelly, that's the white coat effect that you're talking about. There's actually also the opposite. Some people will have high blood pressures at home, but they'll be normal in the doctor's office, just the opposite. And so that person should be treated for hypertension. So that's one of the reasons. So several good reasons on doing that. And so kudos to you for doing that and leading by example.
Yes. And, I've had my bouts of being on and off blood pressure medication with my lupus, and I had preeclampsia with my pregnancy. So I'm always very aware of my blood pressure and making sure I'm not getting into the danger zone. Now, I have questions, but I'm going to put my questions aside, because I want to make sure we get to all of these questions here. We have people joining from all around the U.S. today, Dr. Thomas, so this is exciting. Cheryl is joining us, and her question is, how do you know if your heart disease is related to lupus or not? I was just recently diagnosed with coronary artery disease with a very high percentile.
Usually you do not know exactly if it's due to your lupus or not. And by the way, the reason that this happens in lupus patients is that when lupus causes active inflammation, for example, let's say you have a flare up of your lupus and you're having some joint pain, and let's say it doesn't bother you very much and you don't think it's a severe flare up at all, but your lupus at the same time causes inflammation of the blood vessels in your body. And it's that inflammation over time that increases the risk of the clogging of the arteries over time. So when we look at all of our lupus patients, on average, they develop heart attacks and strokes, clogging of the coronary arteries 10 years earlier than their peers. If you're an African-American woman, it's 20 years earlier. If you're a juvenile lupus patient like you were, Kelly, those patients can actually commonly get these heart attacks and strokes in their late 20s and early 30s. So it's such an important problem. You don't know if it's absolutely due to your lupus, but your lupus certainly did play a role at some point, most likely. Now, there is another way that we can know that lupus does cause coronary artery disease, and that's something called the antiphospholipid syndrome. One of my patients with bad lupus nephritis, he had very high levels of these antiphospholipid antibodies, such as anticardiolipin antibody, beta-2 glycoprotein 1 antibody, lupus anticoagulant, and these cause increased clogging of the or thickening of the blood. And he actually had a heart attack and clogging of one of his arteries because of that. And the treatment is blood thinners, taking Coumadin or warfarin for the rest of their life. Now, that's why one way that we can know 100% that lupus is the cause, but otherwise they happen earlier than they should, and most likely your lupus did play a role.
Yes, yes. And so,
and by the way, the reason I mentioned that flare, by the way, is a lot of times patients will think that their flare isn't important and it's mild and it doesn't need to be treated more aggressively, but all flares are bad. We know that even mild to moderate flares increase the risk of ongoing permanent organ damage twofold, or twice as much as they should. So you need to take all flares seriously.
Well said. Yes. And so, follow-up question: can lupus cause a stroke?
Absolutely. It can actually cause stroke through the inflammation process. One of my very first patients, she's a lovely lady. I still see her now 25 years later. She's doing well. But I first met her in the hospital and she had a severe stroke where she had her first lupus flare and it attacked her brain and the blood vessels in her brain and caused clogging of them. And it did it so badly that she is unable to express herself or talk. And to this day, she has to write everything down. So absolutely, lupus can. That's one way it can do it. It can also do it through the antiphospholipid syndrome, like I mentioned for the heart just now, and we treat that with blood thinners. She did not have that. And then, of course, just that regular inflammation over time that causes strokes to happen earlier.
Oh my goodness, a lot going on, and it's so great that you're still seeing her right now. So next question is, does lupus play any role with a PFO? And I'm not that familiar with that term. I'm assuming it's something to do with the mechanics of the anatomy of the heart.
I have no idea what PFO is. You'll have to type it out for me, Cheryl.
Yes, Cheryl, please. That would be great.
That's the problem with acronyms. I try to not use acronyms as much as I can because we don't always know if people know them or not, even the doctor.
All right. Well, and there's many that can be used for different things too.
Yes.
Let's see here. Tricia says, I struggle with anemia and fatigue. So when I try to exercise, I get SOB, S-O-B.
And shortness of breath.
Okay, there we go. Thank you.
That one I know.
That one you know. How can I tell when it's caused by the low hemoglobin versus potentially heart failure?
Sure. And so this is a situation where you need to work closely with a hematologist and or a cardiologist. And for example, in your situation, it would be a good idea to actually do a stress test with a cardiologist where you actually do on a treadmill. You're not going to be able to go as fast and hard as other people, but they'll be monitoring your EKG at the time, and they can actually tell what happens to your heart while you're exercising, and they can give you some guidance as far as how hard you should exercise, what your target heart rate should be. And so that's a great question. And also, this is a good situation where you may want to work with a physical therapist as well to find that exercise regimen that's safe and effective for you, but also in tandem with the cardiologist's help.
Yes. Gail is joining us, and her question is, do statins help? And that, I'm assuming, is for treatment of high cholesterol?
Absolutely. Thanks for asking that question, Gail. Some lupus experts think that all lupus patients should be on a statin because the risk of heart attacks and strokes is so high in all of our patients. Plus, interestingly, statins have anti-inflammatory properties. So there's the question of could it possibly help with the inflammation of lupus as well? I personally don't think that statins should be used in all of our patients because we need to have studies that actually prove that, and there are none. But if a patient has a high LDL or a high total cholesterol level, absolutely I want them to be on a statin. And sometimes I have to be proactive and pretty aggressive with trying to get the primary care doctor to agree with me, because a lot of doctors don't realize that lupus is a risk factor for heart attacks and strokes, and need to be treated more aggressively than your average person off the street.
Absolutely. Now here's a question, follow-up question about the G1LP shots. To help risk to lower BMI. So the question is, do you think that these shots that are being used to help lower BMI is actually helpful to reducing cardiovascular risk?
Absolutely. There's so much research right now, Kelly, that shows that people who take a G1LP, and that's the medicines like Wegovy, for example, that the stars take to lose weight and so forth. But there's a lot of research that's already been shown that people who use these agents do have less heart attacks, less strokes, and live longer. And we're actually seeing that also in our patients with autoimmune diseases such as lupus. There is some research to support that. So today, for example, in our clinic, one of our nurse practitioners runs a weight loss clinic because it's such a common problem in our patients, of course. And she's found it pretty easy to get these approved by insurance companies because the research supports their use, and they know that in the long run there's going to be they always want to save money, of course, and of course that's going to save money because there's going to be less hospitalizations in patients because of decreasing those heart attacks and strokes. So absolutely I agree with using them, and in the vast majority of people they are safe and effective.
Wow, there you go. Heard it here. Okay, so Robin's here and she says, I had to ask for a calcium score. Why don't docs do this? I was 55 and my score put me in the 70 plus range.
Yeah, actually more doctors are doing it, at least in our area. I know that the cardiologist that I work very closely with in my lupus patients, he orders it all the time. Myself, I don't order it because I don't know the parameters or what insurance covers and things like that. So that's the reason I don't order it. But I do have my patients see a cardiologist to help me with those decisions, and my primary care doctors order it as well. So there's certain situations where they should be ordering it, but to be honest with you, Robin, I'm not sure what those parameters are. But I agree with you, it should be done because it can catch people like yourself where they know that they're at high risk of heart attacks, and then they know that they should be motivating themselves to do better with their numbers and everything. And I'm sure you're doing that after you heard that information.
There's a question by Trisha, not a question, but a comment about prednisone. And this was something I wanted to ask you as well. So maybe I'll just dovetail on her comment. Prednisone can cause weight gain. The longer you're on it, the more you can get those fat deposits. That made me wonder, is one of my questions, how prednisone long-term, is there data that says that those of us, unfortunately, that have been on steroids for dozens of years, some of us, does that impact cardiovascular health, and how so?
100% yes. And that's been shown by studies, especially like from Dr. Michelle Petrie at the Johns Hopkins Lupus Center, but also many more as well. The studies clearly show that patients who are on prednisone compared to patients who have never been on prednisone but have similar disease activity, that there's more permanent organ damage, to include heart attacks and strokes, in the patients on prednisone, even very low doses of steroids. There was a nice study from a large group in the Pacific, which includes Australia, New Zealand, and the Asian countries, and they showed that even 2 milligrams a day of methylprednisolone increases ongoing permanent organ damage, to include heart attacks and strokes. How does it do it? It's probably because of the abnormal metabolism that it causes. It actually causes an increase in LDL. It causes more fat to accumulate in the body. It causes increased glucose levels. It causes higher blood pressure. So all of those things, as we know, are risk factors for heart attacks and strokes. So it makes sense. In research studies, we can measure organ damage in our patients, which is very important because with therapies, we want to prove not only that they reduce lupus flares and help people feel better, but we want to show that they decrease ongoing organ damage. And we use a tool called the SDI, stands for Systemic Lupus International Collaborating Clinics Damage Index. And one of the things that will give patients points is if they get a heart attack, or if they get a stroke, or if they get a blood clot. And we think that many of those are related to the steroids as well as to their lupus. Oh, and by the way, that brings up a good point. Lupus is one of those weird diseases where it's not just the disease causing permanent organ damage, but it's the medicines itself. One of the first law of medicine is to first do no harm, yet one of the main medicines we use to treat our patients is steroids, which is guaranteed to hurt our patients. So we're continuing to try to find therapies to try to get rid of those steroids. And fortunately, today we use much, much less steroids than we ever have in the past.
Yeah. I can't imagine being in your shoes and knowing when someone is having a intense flare where there is significant swelling in their vital organs. The first thing you think is steroids, get that inflammation down, but then it's like, but don't keep them on it too long, because then the damage will come anyway. I mean, it's so hard to figure out, what's going to work best for each particular patient, knowing that steroids still tend to work the fastest among any other drugs that are out there.
Absolutely. In fact, it's the only one that works that fast. So we really have our hands tied.
Okay, this is a great question. This is from Robson, and they say, I can't tell if it's the looks like two people there. I'm not sure who's talking here. So I'm going to say they. They say, how about CRP, C-reactive protein, as a blood marker data point for cardiac health status? Also, is CRP or ESR better to measure inflammation for lupus? Thanks. A little 2-point question.
Sure. So Robson is asking about two blood tests. One is CRP, C-reactive protein. The other one is ESR, erythrocyte, which is red blood cells, sedimentation rate. Both of these can increase when there's inflammation going on and decrease when there's decreased inflammation. In most of our lupus patients, they're not helpful, by the way, because they're just so non-specific. There's so many other things that can do it. But there are some lupus patients where both of those are helpful. Like if I have a patient who has a lupus flare, when I first see them, they have a high CRP, for example, and let's say their sedimentation rate is normal, so it's not going to be helpful. And then it goes to normal when I treat them. And then they have a flare up, and then I see it go up again, then it gets normal when I treat them. I know that in that particular patient, CRP will be helpful, but it's not helpful in most patients. For example, it can be elevated just simply from being overweight. Obesity can cause a high CRP, for example. Being at high risk of a heart attack or stroke or increased risk can have a high CRP, specifically one called high sensitivity CRP. And whether it's due to the lupus inflammation or whether it's due to a reflection of increased heart attacks and strokes, you're not going to really know, but we know that lupus inflammation increases that risk anyways. And so you just need to take it seriously and just do all the things you can with diet, exercise, controlling your blood pressure, your cholesterol, etc., because you really don't know the answer to that.
Wow, that is so fascinating. So my follow-up question would be, if CRP and ESR measures are not that helpful with lupus to measure inflammation, what do you look for? Like, what is your one go-to? Or are there a few that you kind of go to in besides the patient telling you that they're in pain here or there, or they're having the symptom in the labs?
Sure. And so some of the labs that can be helpful is a high anti-double-stranded DNA. If it goes high with when you're having disease activity, then it goes to normal or decreases when you're under good control, and then it fluctuates reproducibly, then that's helpful. And it's the same with the other ones I'm going to mention. C3 and C4 complement can go low and then go high with disease activity. I'm sorry, go low with disease activity, then go high when they're doing really, really well. So just the opposite of anti-double-stranded DNA. But that's only helpful in about 20% of patients. There's another measurement of complement that's actually more helpful in more patients, and it's called EC4D. It's a blood test that's done by a company called Exogen. They do something called the AVISE test or AVISE panel. It's actually a much better test. Unfortunately, most insurances won't cover it, which makes me angry. And the reason for that is that all the tests I'm mentioning are from the 1960s and older. It's so difficult to get the better tests approved by insurance companies. And the one I just mentioned, EC4D, is a better test, but insurance companies just put a block into us being able to use it in many of our patients. Another test is anti-C1q antibody. It can be high with disease activity, low when our patients are doing better. Gamma globulin level, the same thing, high when they're having active disease, low when they're doing better. Also, the blood counts can be helpful in some patients. If we see for example, the white blood cell count go low with disease activity, then get higher when they're doing better, that can be helpful. The lymphocyte count, which is a type of white blood cell, can do the same as well. So what I do is when I see a patient with lupus for the first time, I check all of those things, and then I follow them regularly, and I look at the patterns, and then usually I can be able to tell after a while what's going to be their particular lab tests that are going to help me follow them. But some patients have zero lab tests that are helpful. We need much better biomarkers or laboratory tests for lupus patients. Unfortunately, there's a lot of research out there now being done that are finding better tests.
Fascinating. Did you mention C3 and C4 too? Is that on your list or?
Yeah, that was after anti-double-stranded DNA. They'll go low with active disease, and then they'll increase when someone's doing better. And only 20% of patients.
Ah, that's me. I'm in the 20.
And that's my patient who had the cardiomyopathy that I was never told about, and she had that low C3 and C4 when I saw her, and she looked great, but it was a reflection that her lupus was active, and it just wasn't telling us yet.
Each patient is such a unique snowflake. How it presents in labs and in clinic, and gosh, I'm sure everyone watching wishes they lived in Maryland to come to your office. I know that when and if you decide to retire, it's going to be so sad because people just love how thorough you are. Oh my gosh.
Well, thank you.
Okay,
I'm retiring in about 30 years, so.
Oh, thank you. Thank you. Oh my goodness. We have someone that says, does Plaquenil protect the heart? I've been taking it off and on for 11 years. I know you kind of mentioned that already, that taking your HCQ the right way can lower your glucose levels and kind of help with, did you say cholesterol? Did you say that? Did I hear that correctly?
100%.
Yes.
Yeah, they actually did a study in diabetics, didn't have lupus, and all of them were on diabetic medicines called sulfonylureas. Half of them they gave hydroxychloroquine, which is Plaquenil, the other placebo, and the group on hydroxychloroquine had significantly better control of their diabetes. And there's multiple other studies that have shown that. We don't know why, but it definitely does that. So absolutely, off and on hydroxychloroquine over the years. Please stay on it. We call it's the only drug proven to prolong survival in lupus patients. The only drug proven to extend your life expectancy. You know, when we look at a drug, we always do a balancing act. We want to have a drug that has a lot more benefits and not very many side effects. Hydroxychloroquine is the only medicine where that separation is just ridiculously wide. For example, we rarely see severe side effects from this medicine. The most important one is the eyes, but if someone gets their 2 eye exams done every year, the eye doctor would catch something way before they would have any vision problems. And that's really the only major side effect that's worth mentioning. There's some very rare other side effects like heart involvement, for example, but incredibly rare with those. But the benefits, lower cholesterol, better control of diabetes, less blood clots, living longer. It decreases organ damage. It decreases lupus flares. It decreases lupus disease activity. And for years, it's been suggested that it decreases heart attacks and strokes. But just 2 years ago, a very nice large study actually showed that it decreases heart attacks and strokes and blood clots. Also, 30 years ago, we would tell our patients not to get pregnant, most of them. But today, the vast majority of our patients will have normal outcomes with pregnancy. And if they take hydroxychloroquine throughout pregnancy and low-dose aspirin, it's close to the chances of having a normal outcome compared to someone who doesn't have lupus at all. So there's just a ridiculous. Oh, also hydroxychloroquine has been shown to decrease infections in our patients. Remember, the second most common cause of death. Also decrease some cancers decrease as well. So it's just ridiculous, the number of benefits.
Oh, thanks. So, and if people are armed with that knowledge and understand, and that can debunk any fear of the unknown with taking it too, because I know there is a lot of fear mongering when it comes to that medication in the eyes. Not to say it cannot, like you mentioned, in some rare cases impact the eyes, but getting those checked, your eyes checked by an ophthalmologist is so important, but just the benefits are so outweigh any potential side effects. Let's see. We got an answer to the PFO, patent foramen.
Yeah, patent foramen ovale. That's a congenital. That's a congenital problem and not a lupus-related problem, at least not that I know of. But I'll just give a caveat that lupus can do crazy things, and we're always finding new things that it can do. So who knows? It might not be. Who knows in the future if it shows that it does? But right now, we think that it's mostly congenital and not related to lupus inflammation.
Oh, interesting. What are your thoughts on supplements in heart health and cardiovascular health? Some people take magnesium to help with, fast heart rate and kind of palpitations. Is there any supplements that you have seen your patients use or that you recommend?
Sure. My view with most supplements is that it's very important you always let your doctor know or ask before you start taking a supplement whether it's safe for you to take that supplement. A lot of people think that natural herbs and such are safe because they're natural, and that's really not the case whatever. If they help you with the disease in your body, they're doing stuff in your body that not just beneficial stuff, but also stuff that could possibly be harmful because they're causing something to change with the cells in your body and the chemistry inside of your body. Just an example, there's the autumn crocus, which is a beautiful flower that comes out in the fall, and we get colchicine from that. But little tiny doses can cause death. Even though it's a natural supplement and we use it as a medication now. So always let your doctor know ahead of time. As far as red yeast rice, I can just tell you that it's probably safe for lupus patients. Is it truly effective? That I'm not really sure. I'm not an expert with supplements and cholesterol levels, so I can't really say for sure. I would like to mention 2 groups of supplements. I can tell you 6 or some that I can give you a group that you should avoid and a group that may be helpful. So ones that you should avoid is any supplement that says that it boosts the immune system or supports the immune system. Just remember, lupus is a disease where your immune system is overactive already. The last thing you want to do is boost it. And so medicines like elderberry, echinacea, And if you go to my website, I actually list 6. They did a study recently that showed that these 6 cause lupus flares. Never take those particular supplements. In fact, Dr. Petrie at Johns Hopkins, she had a series of patients who had severe lupus flares from taking echinacea every day because they thought it would help them with preventing colds and such, which is not proven, by the way. And 2 of them had such severe flares, she had to use chemotherapy, cyclophosphamide, to control their lupus. So that's how bad those agents can be. There are some supplements that can be potentially helpful. Turmeric or curcumin is an example. Ginger supplement. One called NAC is another supplement that's been shown in very good, large placebo-controlled trials that it probably helps out lupus patients as well. So some can be helpful, some are not. By the way, garlic is fine. You'll see stuff about garlic being dangerous for lupus. That's not the case. Even Johns Hopkins still has it up on their site. Why is it up on their site? Dr. Petrie and the other doctors, they don't have time to go through all the old blog posts and take down anything that's changed over time. So it's still up there. It's probably going to stay up there. But garlic has actually been used in some anti-inflammatory diets recently. Just eat it in moderation.
Yeah. Yeah, I had put garlic in one of my blogs from a while back, and I got some private messages like, how could you say that? I'm like, things are kind of always changing, and more research comes out, and you adapt. You do the best what you know, and then you do better.
You're right. I've said things wrong in the past that now have been proven to be incorrect. We just are constantly learning new things.
Yes, we are. Okay, this is one about CAR T therapy. Dr. Thomas, what is your opinion on CAR T therapy becoming mainstream for SLE? Do you think we are years away from this treatment or sooner?
So yes, CAR T cell therapy, I'm in love with it. It's the new chapter. It's the next chapter of treating autoimmune diseases. For those who don't know what CAR T cell therapy is, go to lupusencyclopedia.com, my website. Type in CAR T, and I break it down, and I simplify it a lot so it's easy to understand. So basically what they do is they take the person who's very sick with systemic lupus, and they go ahead and take out their T cells. T cells are a very important part of the immune system. And then they engineer them so that they're taught to attack and kill B cells. The importance of that is all lupus patients have autoantibodies that attack their own organ. The vast majority of you watching this are positive, for example, for anti-nuclear antibody, anti-double-stranded D antibody, anti-Smith. It's the B cells that are making those antibodies that are attacking your own body. So then what they do is they put these engineered T cells that can kill B cells back into the person's body. They kill all those B cells, and then something very interesting happens. The immune system resets itself because there's still cells inside of the bone marrow that can make B cells. And so the bone marrow starts to churn out more B cells. And lo and behold, these B cells appear to be normal. And the vast majority are not making any of those autoantibodies. And so now this therapy has been tried in over 43 systemic lupus patients who had severe therapy-resistant lupus, and all of them except for a couple went into complete drug-free remission, where they were in complete remission, no antibodies whatsoever, even their ANAs went negative, and they were off medicines like hydroxychloroquine. 2 of them have gone now past 4 years with doing this as well, and the side effects were minimal, which is just phenomenal. So why are we not adopting this in everyone? Well, number one, we need to have better, larger studies to just prove it a little bit better. And that's going on right now because it's just so impressive that a lot of pharmaceutical companies are jumping on the bandwagon, and we will have much better answers in a few years. But it's going to be very slow to be mainstream. And the reason for that is that it's incredibly expensive to take these cells out of someone, keep them safe in a sterile environment, engineer them to kill B cells, and do it in such a way that it's very safe to put back into the patient. You can just imagine how ridiculously expensive that is. We're talking about hundreds of thousands of dollars. So the process needs to become cheaper. Also, looking at better ways to do it. For example, having being able to do it from humans, that instead of from the patient themselves, do it from other people who can donate the cells and then have them what we call off the shelf, where you can just give it to someone and be able to store them some way. That would be a much better option. They're just doing so much amazing research right now. I'm just really optimistic about the future, and I think it will become mainstream, but it has to become cheaper and easier to do.
Yes, and hopefully we're heading in that way. I know there's lots of different studies and different variations of CAR T therapy going on, and had the privilege of being on a few patient panels regarding it. So hopeful for that. Okay, we're running out of time here. I had one last question. We didn't talk about a cardiovascular phenomenon that a lot of us have with lupus, a little overlap condition called Raynaud's disease. How do you feel that ties into this talk about the heart and cardiovascular health?
Sure. If this was a talk about cardiovascular overall, I would have actually absolutely mentioned it, because Raynaud's affects the arteries that go to the hands and feet, but it just kind of just stayed with the heart. So Raynaud's is a very common problem in lupus patients. It's due to a couple of things. Number one, the arteries that go to the fingers and the toes are smaller than normal. And so what happens is that when any of us get cold, or any of us get stressed, the small arteries in the hands and feet, they just automatically constrict. And that's to help to keep the vital blood, the warm blood around the vital organs of the body, like the brain, the kidneys, and the heart, and so forth. And in most of us, it's no problem. Our fingers will get cold, or toes will get cold, for example. But in the person with Raynaud's, they'll lose so much blood flow that they'll all at once start to get purplish colored ends of their fingers. And then in some people, after that, it will get white in color. And then when they warm themselves up, sometimes there's a red flush to the fingers. So the sequence is blue, then white, then red. But a lot of people only have the white or only have the blue, for example. Another problem is that we think that it's due to an abnormality of the autonomic nervous system in some patients, where they're just overreactive with the nerves, telling the arteries to squeeze harder than they should with cold exposure and so forth. This is one of those things, by the way, that usually does not get better with therapy. Like most things, like the arthritis, the rash, pericarditis, those get better and should go away with a proper treatment. But Raynaud's is usually a permanent problem in most people. I've only had a few patients where it did absolutely get better by calming down the immune system, but most people it's permanent, because there's some permanent permanent narrowing of the arteries that go to the fingers and toes. So it is an important problem.
Yes, well, so much helpful information here. I feel like we barely scratched the surface, but there are lots of people very interested in this conversation. So maybe we can do a part 2 down the line. Thank you so much for your time today, taking time out of your Saturday, and I know you've had a busy week. And once again, where can people find you? What's up next for you? Do you have any other things coming up that we can join you on? And how can people find you?
Sure. So if you go to lupusencyclopedia.com and join my email list, and whenever I put up a new blog post, I blast out an email letting you know there's a new one up there. Also, I'm on Twitter, but it's Lupus Encyclopedia without the EN, because they only allow so many letters. So Lupus Encyclopedia, and I oftentimes will put out information about new research studies and so forth there. Then my Facebook page is also also Lupus Encyclopedia as well. And as far as talks and such, I have a lot coming up with educating doctors, thank goodness. And by the way, boy, I wish our government would get better. And I don't like to be political, but I'm so angry at the Trump administration. For example, I had a lecture that was supported by the CDC for primary care doctors to teach them how to diagnose and treat lupus patients better. It was canceled because the decrease in funds. It's just horrible what's going on at the NIH right now with them taking money away from very important research studies. I'm just so angry, Kelly. I don't want to be political, but when it affects my patients, I get angry.
Right.
But anyways, everybody, know your numbers. Stay proactive with your health care. And if you take one thing away, know your numbers and ask your doctors what to do to keep them perfect.
Thank you. It's a great thing to end on. I was trying to put that stuff in the comments as you were talking because such great information. Thank you again, Dr. Thomas, for your wealth of knowledge. And if anyone has any follow-up questions, you can put them here and we'll do our best to address them. And thankful for all of you joining. We had a great crowd today. This is available on YouTube to share as well. And take care, guys. And remember, know your numbers. There are many things you can do to take the reins back to your cardiovascular health. And Dr. Thomas, I posted a link to your website, your Lupus Secrets, which have helped me tremendously. And don't forget to get the second edition of the Lupus Encyclopedia, which is on Amazon. A must have for everyone who has lupus or for a loved one to learn more about lupus. Thank you again, and we'll see you next time, Dr. T.
Thank you, Kelly. Keep up the great work with More Than Lupus. Bye-bye.
Thank you. Well, there you have it. Please share this if you haven't done so already. What a wonderful talk. We could have probably talked another hour. And stay tuned next month. We have some things coming down the pipe for about microbiome. And we have a brand new blog out about the American College of Rheumatology 11-point criteria on our website right now. By the way, pericarditis is on that. It's one of the criteria, either pleuritis or pericarditis, one of the 11-point criteria by the American College of Rheumatology. So that's it. That's all I have for you today. I've got my son here. I've got a full house. So I'm going to get back to that. Thankful for you spending your Saturday afternoon with us, and know your numbers and get one of these, people. Okay? Take care. Rob, I will let you know. I'm still working on that. I'm working on the blog first, and then I'll let you know about the microbiome. Okay? Take care, guys. March is microbiome month, so we're going to do it during that. A gut health month, I think. So anyway, take care, guys. I'll see you soon. Bye-bye.